Hello, everyone. Welcome back to the BioNexus Health podcast series, Autism Uprooted. Today, we will be traveling just a little bit to New Jersey and speaking with a remarkable mom who has achieved phenomenal results with her little one on the spectrum. She brought her son to me when Harman was only 2 years old, and we've seen him improve by leaps and bounds. So let's proceed and welcome his mother Gagan to today's podcast.
Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
So Gagan, welcome to the podcast. Thank you so much for being here today.
Thanks for having me, doctor.
Good. Okay, so let's jump right into it. You came to me after doing some research and deciding you wanted to have an all-natural approach for your son, and he was only 2 years old, which is great. I mean, as I'm sure you must have researched that as soon as you start seeing any kind of symptoms, right, younger is better for the most progress.
Yes, doctor. I heard your podcast, camel milk podcast.
Okay.
Today, another practitioner, and that got me going because I was already doing multivitamins. I was doing probiotics along with detox bath. And I was like, okay, let me try camel milk. So I came across this podcast, and you were the guest on that podcast, and you were very detailed about how camel milk should be included and not too soon, just exact on the right time. And you don't want to make things worse for your child. So at that moment, I was like, no, this is my doc. I'm going to make my appointment with Dr.
Right.
I did. And I remember my son he didn't turn 2 yet. It was like, so as soon as he turned 2 and I made the appointment, and then we started with you.
Okay. Yes, perfect. Well, that's true. What you say that, and I'm glad you paid attention, because when there are underlying conditions like children being on the spectrum, but they might have so many other conditions, as we later found out when we ran labs for Harman, right? We saw a lot of concerns, but that's exactly what needs to be done. It's important to know the underlying issues before you just start to introduce IgG and various other antibodies. I mean, camel milk is wonderful. But as with everything else with chronic disease, you have to watch what you eat, and it has to be introduced at the right time. So yeah, perfect. Glad you mentioned that. So can you walk us through in the beginning what symptoms were concerning you about your son, and that you decided to seek help? What was happening?
Like, first is like, of course, it has to be with speech. They're not talking, and he was not talking at all. And we were very concerned. Nobody else in the family was like this, the way he was. And I have other children, so I know when they talk at the time, even earlier than their age. And we were very concerned that he was a very quiet child. He will not talk, like he was like kind of slow, and he will not give any gestures, no hi, no bye, no waving at all. He was like a very quiet child, and he was like constipated.
Okay.
He was very constipated. He was not social at all. And then that got me really concerned. I was like, something is wrong with him. Something is behind the scenes that we cannot see. And like at that time, we did not had any diagnosis, but I knew in my gut that something is there, something is wrong, it's not right. So, as a mom, you investigate, and then I took him to our pediatrician, and I told her my concern. This is what's going on at that point, and she was like, "Okay, we'll just wait for a few months and let's give him some time."
Okay, makes sense. Mm.
I was like, "Okay, everybody say, oh, boys are very slow, as usual." And I was like, "Okay, let's give a little bit of more time." So then I put him in daycare, and the teacher, she's like, he's not on the same level as other kids were. So that hit me really hard. And I was like, no, I'm taking him back to the pediatrician. So in the meantime, I was like writing everything down, what he's doing, what his actions are, how he behaves, and
Mhm.
So I wrote everything down, and I took him to my pediatrician, and I told her my concern, and I was telling her like this is what he's doing, and I'm really concerned. So at that point, the doctor put him under EIP.
Oh, early intervention program at that point. Okay.
And then she also gave us a referral to see a pediatric neurologist.
Okay.
So I was like, okay, so we had to wait about like 3-4 months for that doctor appointment, and then we got his EIP rolling. And then in the meantime, I was doing my research why he's this way. So then I found you.
Mm.
So we got your appointment. At that time, we did not have our neurologist appointment yet.
Not yet, right? I remember that, yes. And one thing I was also happy about that we were able to run all the labs for Harman, at the time. And I remember when we looked at the lab results, you were quite a bit shocked, but right, yeah. So what do you remember from his labs? What did we find in his labs? Can
Uh, like I know, like he found he had gut issues. He had a leaky gut, and then he had like other infections. So we had him on a protocol.
Oh yes, yes, yeah, we did. Yeah, I mean, it was the poor kid just at such a young age was going through a lot of infections and toxins and heavy metal issues and gut issues, and these toxins could impact his endocrine system, his digestive system, his detoxification pathways, right? So that was the most important thing for me to have you understand. And yes, we did come up with a personalized protocol for him based on the labs. And that's what I found, that if we just correlate what we find in the labs and just treat that, and then look at the big picture, I've seen improvements happening in almost every child, right? Now, this is an all natural protocol. It's all herbals, which is what, I think you wanted to do as well, right? Versus doing a lot of medications. Um, so yes, how did you manage? I've really been very appreciative of the fact that how you manage uh, the protocol because it is herbal and not every child enjoys the taste. Sometimes mom have to use some juice or some applesauce. So how did you manage the protocol? And then, I know he's greatly improved. So how did you start seeing the improvements?
We like initially, me and him, we were both trying to work out with the herbals. Like initially, he was like, "Okay, what is this?" But like as gradually he knew, okay, this is what I have to take. Now he's happy to take them. He's a pro at it. He looks for it. Like if I'm a little bit of late, he's like, then he started getting a little fussy. Where are they? So I give it to him on time. Now we have no issues. It's very smooth. There was no issue making the cocktails. You just make them 3 times in like 3 small glasses in the morning, and you're all good to go. In the beginning, when we started giving him the herbals, like after a few weeks, he started pointing.
Oh, nice. All right.
He started pointing. He was happy. He was not as much constipated as before. His stomach was getting better. His gut was getting better. He was getting more expressive. Yeah.
He was getting more expressive. Okay, okay. I mean, I can see your smile is just so wonderful to see. I remember when I first met you, you know, the amount of anxiety you had on your face, and now the appointments are so, you know, to see you less stressed from one mother to another, you know, it's just so nice. Um, Good. So he has language. Is he speaking? Is he using words?
Yes, he does have few words. He would say mama, dada, and
Wow.
he will take his sister's name. If he wants something, he will say my. That's how he,
Okay.
yeah.
Okay. You know, one thing I remember you mentioned that at school he's doing really well with letters, numbers, colors. Like, can you talk a little bit about that?
He's scribbling now, he's coloring, he's tracing letters now, A, B, and C's. So I'm really happy about that.
And he's just so little, and he is, you know, so smart, and all his smarts are showing now that, you know, his inflammation has calmed down, his brain inflammation, gut is getting better. um, Good. So this is all the positives. I do remember that he had a recent flare up.
Yes.
Yes, so this was, you know, strep exposure, and after that flare up, he came out of it. But you know, it's important. I mean, I know we used additional doses of herbals for the flare as it needs to be done. But uh, I just want you to kind of, you know, emphasize the fact that during the flare up, of course, it's a pans pandas flare. And during the flare up, you see a lot of symptoms like obsessive compulsive disorder, you know, a lot of stubbornness, some aggression. These are all symptoms of PANS pandas, which can sometimes mimic the symptoms of severe autism, even, you know, so it can be mistaken. But when he came out of the flare, there wasn't, you know, any regression. He did not lose all the gains he had made. So can you talk a little bit about that? You know, just to hear it from you that the gains were there, because one thing that I've seen with a fully herbal protocol, that even though it's all natural, whatever changes or gains you see, they stay with you.
Yes, doctor. He did had a flare up. He was humming, stimming, being very obsessive, aggressive, and then it was about for a month, but they all came back. The gains, they all came back, and it was strange that even though he had a flare up, but some of the gains it was still with him.
Oh, even during the flare up, he maintained the gains, right? Yeah, that's a good point you make. Yes, yes. Many moms have mentioned that as well. You know, and one thing to take note and take heart is that the flare-ups in the beginning, you know, it's an autoimmune condition, so 4 to 6 weeks. But as we, because he's still relatively early on in the herbal protocol, like you mentioned, you know, within a few weeks you started to see improvements. Now, as we continue, as the body and the gut and the immune system and the brain, the inflammation continues to reduce, the infections are slowly going away. I've heard from other mothers who've reached that level that if there is any re-exposure, a flare-up happens if there is a re-exposure. So the flare-up will only last like a couple days. So that's what you have to look forward to as well. He's already responded so well to the herbal protocol. And, I love when you say that he's asking for it now, because internally, the smart little boy knows that it's making him feel better. So,
Because that's what I feel. Post like the cocktail comes, he knows the time in the morning.
yeah.
For it, he's not like making faces or getting upset about it. He loves it. Like he has no issues taking it. Not even the capsules, he takes it happily. Even the charcoal, he has no issues taking it. He's happily taking it. This boy is like so sweet.
Yes, he's an amazing child for sure. Everything that I've heard about him from you. And yeah, he's happy, all smiles. I love that. Yeah.
Yeah. Last 2 days we were going to our temple, so we have to cover our head. We have to wear a scarf when we go. Before, he was not like that. He did not want it to anything on his head. So we took him. We've been going there for the last 2 days, and he kept it on, and we were surprised and very happy, of course. Like, okay, good, keeping it on. He's not taking it off.
Okay. So his sensory issues are calming down as well.
Yes, and then I wanted to also mention that we took him for his last haircut. The first time he gave us very hard time because he did not want anybody touching his hair. So last time we went, like I would say almost 80%, he was very cooperative with the hairdresser. So I was very pleased with that. I was like, good, good.
Yeah.
Things are going into the right direction.
Yes, absolutely. Did anything come from the pediatric neurologist visit? Like, did he end up getting a diagnosis?
Yes, that was later on. We were already on a protocol.
Right.
So that was like way later on. We were sent to a psychiatrist for a evaluation for ASD evaluation. So she has given him level 2, that
Okay.
level 2 on the spectrum.
Okay, just level 2. Yeah, and it'll be interesting to see that diagnosis go backwards, level 1 and then vanish.
Yes,
So that, I mean, I see this all the time. So that would be wonderful. And he has such a long way to go. He's in preschool, like preschool right now, and he's already making so much progress.
yes.
So yeah, he has a very bright future.
All thanks to you, doctor. All thanks to you.
Oh, it was my pleasure. My pleasure, and such a blessing. It is really important to have moms like you come forward to speak, because you're very modest about your own contribution, far more than mine, because the diet
Yes,
is not easy at all. Making sure that all the temptations are kept away, explaining to the child that this is what is good for your health. Approaching him like he was a neurotypical kid. There's nothing wrong with neurodiversity, of course, but if a child is not meant to be neurodiverse, if there are problems we see underlying, and if the child is improving, then it is our responsibility to make sure that the child achieves his full potential. So how did you manage the diet? And I mean, it's a lot of effort. So and your life is not easy with other kids. So it would be good to hear from you.
yes, it was definitely not easy. When you have a child has special needs, you are able to do anything for your child to get them back where other kids are, my other children are. And I mean, he's a little boy and he's trapped inside his body. And and you feel like they're so helpless that they want to say something, they want to express something, and they cannot. They're stuck. So like we did step by step, very slowly, and now the palate he has of the food, it's all clean. He does not eat any gluten or dairy. It's all organic. um Even the food we cook with, it's all organic. I mean, his oils, his, grass-fed ghee, even the coconut oil is organic, cold press, even olive oil is cold press. Everything is organic, because when you're making food for your child, it has to be clean. You have to do it from the start. Everything has to be clean. Even the utensil you're using, it has to be clean, like cast iron or stainless steel. So everything counts, because if you're gonna feed your child a clean food, it has to be done right.
Yes, absolutely. Absolutely. Yes. Clean, non-toxic, the environment, what you eat, the way you live, your lifestyle, staying away from fast food. And that is absolutely doable. What you're giving your son is a lifelong foundation of good health, good immune system.
Yes.
So
So,
yeah, I mean, honestly, if a mom of three can do it, cook from scratch, and manage, I think it's going to be very inspirational for many watching this podcast. So I think you've done a phenomenal job overall. Hats off. I know it's not easy. I had one,
mhm.
and it's not easy, even with just one special needs child. I mean, you have two neurotypical, one special needs, but still overall three children, and managing a large family. You have a large extended family as well. So yeah, amazing job. I hope you're looking after your own health as well. I always ask you at all the appointments, are you doing okay, Gagan?
Yeah, I'm doing okay. With kids, it's not the but I'm doing my best. I'm doing my
Good, good, very good. So I must, thank you for once again for being here today for this wonderful podcast. And I hope to see you soon at your next appointment. And all my very best always.
Thank you so much, doctor. Thank you so much. I appreciate it.
So that brings us to the end of today's podcast, Autism Uprooted with Gagan from New Jersey. And I will see everyone at the next episode of the BioNexus Health Podcast, Autism Uprooted. Thank you for joining us. Namaste.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.